Good evening. It's time to talk politics with Ronnie and Sheila. I'm Sheila. Ronnie's away on vacation this week, and we have another special edition of our show featuring Dr. Paul Epstein, who was here with us last week. He's a naturopathic Paul Epstein is a naturopathic physician, meditation teacher, speaker, and holistic therapist. As a practitioner, Dr. Epstein combines an integrative mind-body approach with mindfulness-based psychotherapy that focuses on guiding each patient on his or her self-healing journey and spiritual path. He works with patients and mentors health professionals in his private practice in Westport, Connecticut, and travels widely, worldwide, giving workshops and giving lectures. Good evening, Dr. Epstein. Welcome back.
Welcome. Thank you. Good to be here.
Last week, you gave us a lot of information about the mind-body medicine, which is the specialty of your naturopathic work, right? And one of the phrases that I noticed in reading all of your literature was healing versus curing. And it took me a while to figure out what that was. How do you describe that to us?
Well, in terms of how patients deal with illness and pain and stress, is usually fix me, cure me, get rid of this. And that's natural to want as immediate a response as possible to get out of the pain. And sometimes that works, but most of the time, for many ailments and many illnesses, they're more chronic, of a chronic nature, and they require a different kind of process. And that we might call a healing process, which takes time. And so how I speak about that is that in medicine, we need both. The question isn't a choice between cure me and engage in a healing process. We need the integration of both. So we need to look for what's the diagnosis and what's the treatment and how do we kind of fix this ailment, which might be the cure, so I don't have it anymore. That's the drug or the surgery approach. But we also need how do I transform so I heal it and it doesn't come back and I don't carry it around further. That healing process involves much more the patient themselves getting involved in their own healing journey, which might involve changing their diet, changing their lifestyle, dealing with their stress, looking at their attitude, but being empowered to feel that they are responsible for their health and, in fact, have an important role to play in whether or not they will get well.
Right, because many people, and I've probably been guilty of it myself, we feel disconnected from our bodies. In other words, this is the mechanical shell that I'm living in, and when something goes wrong with it, I have to go to the mechanic, that's the doctor, and he'll use the tools, whether it's a drug or a surgery or something, and fix my mechanical body. And so that's the wrong
That's
thinking.
Looking for the cure. No, it's not wrong.
Okay.
No, that's not wrong.
All right.
It's only one approach.
One part of it.
And it often isn't the whole approach, and it often doesn't get at the underlying cause of how did that occur to begin with. And so while we do want to treat the symptom, and we do want to treat disease, and we do want to do things to cure it in that way that you asked at, what we have to recognize is that another approach is also required. And how I speak about that is an interesting phraseology that says, disease tells a story. Not just of your cells and your diagnosis, not just what it says on the x-ray or in the blood tests or on the CAT scan, and we get the diagnosis. That tells a story, okay, of your cells.
I like the way you said dis-ease.
Dis-ease.
Dis-ease, okay.
So disease tells a story not just of your cells with a C-E-L-L-S, it also tells a story of the self, of who you are. And what happened that brought you to this point. Not what happened that it's your fault that you're sick and you should blame yourself or somebody else.
So give me an example of that, of a life, of a transforming sessions that you have.
I will give you an example.
Who went to the neurologist, the family doctor, the specialist, did all the work that you suggested they do, because one of the important things we learned last week, and that you want to keep reminding people is it's not an either-or. It's not either going to the neurologist or going to see you. It's an integration of both approaches.
It's integration of both, and recognizing that sometimes, again, if it's not life-threatening, it's often simpler and better and more cost-effective to do the simpler, more natural thing first and heal.
So before we get to your book, give us an example of someone who had an issue that came to you and transformed not just the illness, but transformed.
So let me give you an example, because that concept of transformation is an important one, of a shift of attitude, of a shift of perspective, of the importance of the mind-body connection. So I mentioned last week this Holmes scale and the death of a spouse being the biggest one.
H-O-L-M-E-S?
H-O-L-M-E-S.
Yes.
And the death of a spouse being 100 points on the Holmes scale. So if a patient comes to me, I'll give you this example, chronic back pain, severe pain. The chiropractor didn't touch it, the neurologist didn't touch it, the orthopedic didn't touch it. I mean, they touched it, but they didn't cure it, is what I'm saying. The pain was real. There's some osteoporosis, there's some osteoarthritis. She's a 70-year-old woman with pain in her spine. Takes medication. They even tried some surgery. And she comes to see me, 3 years duration of this chronic pain, looking for some help and some answers. She saw wonderful doctors, smart doctors. The therapies they prescribed were not bad, weren't wrong, weren't improper. They lessened it a bit. But now she was also depressed and on painkillers and on antidepressants because the pain was unremitting. And you mentioned the body bears the burden. And she came and I said, so, Mrs. Jones, what was happening in your life when this pain started? My husband died. This is what narrative medicine, Mrs. Jones, tell me your story. I will listen. People need to tell their story. The grief that she suffered from taking care of her husband before he died, to having to be the one to choose to pull the plug on him because he had a living will and she was the person that had the responsibility to decide whether to continue life-saving strategies or not. Her family, the doctors, all deemed the appropriate choice after the stroke, some Alzheimer's, some Parkinson's, a lot of suffering at this point, and some complications was don't do heroic measures to keep him alive, to suffer more. That was the choice. And it was the correct choice on the part of the doctors and the family, but she was the one that had to make that choice. So now the man that she lived with her whole life is gone. She's lived with the stress of having to take care of him and watching him suffer before he ended up in the hospital being taken care of. She had some guilt, justified or not, when I asked her to tell me the story, how can I be taking sips of breath while I made the choice to have you die in the way that she had to deal with that. My point being, the stress of all of that was living in her body. Now, when she came to see me, I can't give her better painkillers. I can't crack her back better than the chiropractor might. And not that those things weren't appropriate and helpful as part of her care. But the real splinter that she was carrying around was the grief and the pain of the loss of her husband and how it happened and how she dealt with it. When I said, how did you deal with that loss? She says, well, I've been too busy going to doctors for my back pain. Yeah. And she also said, I decided I was going to be strong and not fall apart like all my friends did when their husbands died. And sure enough, unfortunately, she fell apart. And I said to her the following. You have a big splinter, Mrs. Jones. It's going to hurt and be painful to take that splinter out, but once it's out, your symptoms, I think, will be relieved. They won't be gone, but I think they'll be better. Do you want to engage in a process where I help you do that? A simple process of mindfully, through meditation, through imagery, through counseling. Tell me your story, Mrs. Jones. I will listen to you.
Narrative medicine?
What I call narrative medicine is let people tell you their story. Okay. Because in my career as a mind-body doctor, disease tells a story. We want to listen. Listening to the meaning and the message of the symptom is how we get to the deeper issue.
So you need actually some psychological training.
Well, I personally, we get counseling and stress management in school, but most of my postgraduate training, I've studied the internal family system model of psychotherapy, and I've been trained in that, and I've just studied Gestalt therapy and other forms of psychotherapy and Buddhist psychology and yoga therapies and a whole host of ways of helping people deal with difficult emotions, deal with holding on to that.
How many sessions approximately did you need with this person?
Every case is.
Okay,
I've had people come in 2 sessions and just have somebody acknowledge that that's where the pain is coming from is what helped them heal.
And how did she wind up finishing up with your office? Did she ever finish up? Is she still seeing you?
She wound up, this was years ago, she wound up seeing me. I actually made home visits and supported her, and I saw her weekly for about 3 months. And little by little, she began to write some poetry. She was talking to her family and friends about it. She was letting herself do the most common healing thing in the world. We grieve. Our country just celebrated is not the right word, commemorated the year of Gabby Gifford. Trauma, sadness, grief, and yet our hearts were warmed by her courage that she fought, and she's recovering and getting better in a sense. And there's grief there. She had to face the truth of what happened to her and the truth of what has happened to her constituents and her staff. The healing is facing the truth of that pain, not covering it up. And so now she's choosing to face and deal with her issue. In a mind-body sense, in our society, I mentioned obesity. The recidivism rate for weight loss in our culture is over 90%, meaning Nutrisystem, Diet Center, Jenny Craig, Weight Watchers, OA, whatever it is, however supportive it tries to be. I'm not saying this to be judgmental or negative, but 90% of the time the studies show, not me saying it, not Dr. Epstein saying it, the studies show 90% of the time the person will lose the weight and gain it back.
What else is new?
And what that proves is the body is capable of losing the weight when you change your diet and exercise, inflow and outflow, caloric and fat. But they're not dealing with the mind and emotions.
Okay.
Did you ever hear of this lady called Oprah Winfrey? When she retired on the air, she was fatter than she ever was, and she was on 20 different diets over 20 years with 20 different programs that everybody in the country tried.
Invited her for a session.
I would love to invite Oprah for a session, but what I'm getting at is she didn't deal with the underlying cause of the meaning and message of her weight, which when I did an imagery session with an overweight person who said to me, Dr. Epstein, I have to lose weight. I'm fat and ugly and I hate myself and I have diabetes and high blood pressure. My doctor told me I have to lose weight again. And I've been on every diet for 20 years. I said, Mrs. Jones, I can give you a better diet, but diet isn't going to cure you. You need healing. You need to look at what the fat means for you, what it does for you, how it serves you, because you've been hating it and trying to get rid of it for 20 years and it keeps coming back. And so I said to Mrs. Jones, when you can tell me that you want to lose weight because you love yourself, then I'm happy to help you, because otherwise I'm reinforcing self-hatred. Secondarily, are you willing to listen to the meaning that your fat might have? And we did an imagery session, and I said, let an image form that represents this fat that you've been hating and trying to get rid of that keeps going and keeps coming back. And she got the image of a down comforter, and she realized that her fat was her friend because it was protecting her from her own sexuality, from having been abused, which is also what happened to Oprah, unfortunately. It happens to many people in our society. And her survival was the weight. When she took the weight off, she felt naked, sexy, and attractive. Men looked at her more as a sexual object. She hadn't healed that component of her trauma and her stress. Her